Now we can cover feeding your child. We will begin with some general information and then discuss both bolus feeds and using a feeding pump. First, we will discuss hang time for formula or breast milk.
Your child will be fed breast milk or a liquid formula that provides the nutrients he needs. Canned formula can hang for a maximum of 8 hours. Powdered formula or breast milk can only hang for 4 hours. Powdered or prepared formula should be discarded after 24 hours.
One of the most common methods for home tube feeding is bolus feeding, where a specific amount of formula or breast milk is given over a short period of time. It is important to start with a small amount of formula or breast milk and gradually increase the amount to the final amount prescribed. Your doctor can help you plan how much to give and how often to give it until you reach this goal.
In most cases, bolus feeding is done with a syringe or gravity feeding set. However, some children will need a feeding pump to control the rate that the formula goes into their stomach, even if it is a small amount over a short time. This is called intermittent feeding. There are several advantages to this method. One is that it's very quick and easy to do. All you need is a syringe or a gravity feeding set and time. It only takes between 15 and 45 minutes. This makes the assembly of equipment, feeding process, and cleanup convenient and easy. The disadvantage is that some children who are prone to reflux or spitting up will not tolerate the feeding.
Before you begin any bolus feeding, follow the instructions of your physician regarding checking tube placement and how much water to flush the feeding tube with before and after the feeding.
Always start by washing your hands. If you are using canned formula, wipe off the top of the can and shake it well before opening it. If you are using powdered formula, prepare enough for 24 hours and then measure out the needed amount for the feeding. Remember to refrigerate the remaining formula until the next feeding. To begin the feeding, it is best for your child to be in an upright position. Do not leave your child alone during the feeding. If your child has a button or low-profile tube, attach the straight extension tubing. You will need to check placement of your child's feeding tube using the techniques we have discussed previously. Now, flush the tubing. Next, pour the formula or breast milk into the syringe. Hold the syringe upright and let it flow through the tube by gravity. To increase the rate of flow, raise the syringe higher. To decrease flow rate, lower the height of the syringe. You can also replace the plunger and use gentle force to push the formula through the tube. Add formula as needed until the correct amount has been given. If you are using the gravity feeding set, pour the formula or breast milk into the bag. Hang the bag on an IV pole so that it's at least 18 inches above the stomach of your child. Remove the plastic cover from the end of the tubing. Hold the end of the tubing into a container or kitchen sink. Open the roller clamp to allow the formula to reach the tip of the tubing. Before attaching the gravity set to your child's tube, remember to flush the tube using the extension set. Then, attach the gravity set tubing to your child's tube and begin the feeding. Opening the roller clamp will increase the rate. while closing the roller clamp will make the feeding go into the stomach more slowly. When the feeding is complete, flush your child's tube with the amount of water prescribed by your doctor. Wash out the gravity bag and attach tubing so you are ready for the next feeding. It is recommended that a new gravity bag be used each day.
Electronic feeding pumps are used to push formula through feeding tubes. They can be programmed to deliver a prescribed amount of formula per hour. They are especially useful for children with reflux and for those who need continuous or nighttime feeding. Electronic pumps come with detailed instructions on how to use them. It is important to follow the manufacturer's guidelines.
Before you get started, always wash your hands. If you are using canned formula, wipe off the top of the can, shake it well, and open it. To reduce the chance of foodborne illness, fill the feeding bag with enough formula for only 8 hours. Any formula left in the bag after that time will have to be discarded. If you are using powdered formula or breast milk, the hang time is only 4 hours. Turn the pump on. Insert or load the tubing that is attached to the feeding bag into the pump. Remove the plastic cover from the end of the tubing attached to the feeding bag. Follow the manufacturer's directions to get the formula to flow to the end of the tubing. This is called priming the pump or tubing. Program the pump with the prescribed dose, or VTBD, which stands for volume to be delivered. Now set the prescribed infusion rate on the pump. If your child has a button or low-profile tube, attach a right-angle extension set. You will need to check placement of your child's NG tube. This can be done using either of the two methods reviewed in the module on placing the NG tube. Check with your doctor on what technique he or she would like you to use to check placement. Attach a syringe to the feeding port and flush the tube with the prescribed amount of water. Then, clamp, pinch, or fold the tube, remove the flush syringe, and insert the feeding bag tubing. Push the start button on the pump to infuse the formula. When the feeding is complete, turn the pump off. Remove the feeding bag tubing and attach a water-filled syringe to flush your child's feeding tube. Remove the extension set from the button or low-profile tube and rinse out and place in a clean area to air dry for the next use. If your child requires multiple feedings throughout the day, you will need to clean out the feeding bag and attach tubing between feedings. Leave the bag attached to the pump and then rinse out the bag with water to remove any excess formula. After the bag has been rinsed out, place a small amount of water, about a quarter cup, in the feeding bag. Then use the prime function on the pump to rinse out the tubing. Discard the feeding set after 24 hours.